Welcome everyone to our Practice Builders webinar series. My name is Lyra and I'll be co-conducting tonight's webinar. Tonight's webinar will be introducing our newest technology solution, myPracticeBuilder. And before we get started, I wanted to quickly address a few items regarding the webinar for quality purposes. All attendees will be muted, and therefore if you have a question during the webinar, feel free to type it into your chat box located on the right-hand portion of your screen, and we can address it later on in the Q&A session. Also, once the webinar has concluded, every registrant will receive a copy of the PowerPoint slides here that you see tonight, as well as a recorded version with audio that you can click on or send to a friend. For those of you who are not familiar with Practice Builders, I'd like to offer a backgrounder on who we are. We have been providing practice success solutions for over 30 years, working exclusively with private healthcare practices. We provide comprehensive solutions ranging from eMedia solutions to staff training for your practice. And now I'd like to introduce our presenter for tonight, John McCumber. John has a breadth of experience with technology solutions related to healthcare marketing, and we're so pleased to have him tonight. May I present John?
Welcome everyone. I appreciate you being here. I am so excited to be able to present what we've been working on for quite some time to you. I've been in marketing for over 20 years and been involved in online and offline with practices and with businesses across the spectrum. And I do have to tell you that the solution that you're about to view today is nothing short of absolutely amazing in its ability to make your practice, allow you to drive your practice where you want it to go. And so we're going to talk about a couple of things tonight. First, we'll talk about your practice in 2011 versus where you want it to go this next year, and how you're going to get there through tracking, converting, measuring, and adjusting all your new patient development activities through myPracticeBuilder. And then lastly, we're going to look at a custom ROI case study for a practice that we work with, and we're going to look at how much profit they're losing each month. And then of course, you'll be able to look at that in terms of your own practice. And how that applies to you. So what's happening with in new patient development, and what are the common pain points that we have found at Practice Builders in dealing with the thousands of practitioners that we work with on an annual basis? These are the 5 pain points that we found, and the first of which, as it pertains to getting new patients, is we don't have specific good data about where patients are coming from in terms of phone calls, in terms of emails and website inquiries. Where are these patients coming from? The lifeblood of your practice. Being able to know and control where that's coming from. Secondly, of course, it's different for every type of practice, but excessive no-shows. This has become an overwhelming problem for a lot of different practices. And what can we do to reduce that and in essence, increase billing per hour? Thirdly, is there's a lack of technology and resources to control patient communication. And what I mean by that is that patients, now it's a multimedia world as far as how patients want to be communicated to. And so what solution can we don't have anything that kind of communicates and coordinates in all the different ways, in both visually and through phones and online and offline. How can we control that? Fourth is the ratio of inquiries to new patients is far too low. We're talking about all the different phone calls, all the website inquiries, all the emails, and what percentage of those are converting into new patients. It's far, far too low. We've got to drive that up. And then lastly, do we have a good feedback loop in terms of are we able to view what our practice looks like from our patient's perspective, and how do they view what their experience was like? We don't know what's happening there, and so that's why we've developed myPracticeBuilder to address all of these issues. Now, in terms of why aren't these patients, these inquiries becoming patients? The first of which is the most important sound that you're going to ever hear in your practice is the phone ringing. I mean, you've got to treat that phone like it's your bat phone. You've got to tenaciously go after each caller that comes in, and you've got to welcome them. You've got to answer that phone with a smile in your voice. You've got to have somebody dedicated to making sure that each person feels welcome. Secondly, Website inquiries, be that from your own website or from a directory site like Looking Your Best for in the plastics industry or 1-800-Dentist or any of the number of different sites that are there to aggregate leads or inquiries for practitioners, those, when someone's filling that out, they've got to be answered in minutes and not hours. And those prospective patients, they've got to be nurtured. You've got to, it takes more than just a single phone call to get them for you to earn their trust and respect. One of the reasons that's not happening is because the staff is absolutely overworked and they don't have the time to manage all those inquiries effectively. And a lot of times the doctors and the staff don't even know when the inquiries are coming in, and they don't even know what advertising or referral sources are delivering the new patients. And so that's why we've developed this solution. And in essence, what myPracticeBuilder does is four things. We track, convert, measure, and adjust all of your new patient development activities. Let me start off by talking about tracking. Every solution is designed for every online and offline effort that you have, no matter whether it's radio, print, referrals, social media, you name it. Every incoming phone call, every referral, every marketing dollar that you spend are all tracked, and it's done for you in a way that's done automatically, easily, and effortlessly. You know, we've taught about the importance of tracking through in our workshops for many, many years, but of course that takes a lot of effort to put something in place that's consistent and reliable, and now we've made that so much easier for you that it's done for you automatically, and I'll go in more detail about what that means. So what are we tracking? We're able to track every different source, whether it's a print ad or radio or referral, you name it. Those are all, you're able to track not only the source, but the marketing dollars for each one. Now, one of the most important ways that we track is we have an advanced call tracking system built within myPracticeBuilder. We're able to capture 100% of every one of your callers from all your marketing and different referral sources. Those all become inquiries automatically inside of myPracticeBuilder. You're able to use unique numbers to track each of those, and every one of those calls can be recorded for training purposes, and you're able to listen to those calls and track your advertising from absolutely anywhere. An example of that, very simple. We give you in blocks of 10 phone numbers in your area code that are then fed into your main line, so whether it's from your website or from a billboard or from Google Places or even a referring physician that you have a relationship with, have a different number that's fed into your main line and then is fed into Practice Builders. Here's a good example from your website. A lot of you I know have these inquiry forms on your website. If you don't, feel free to contact us and we can get this set up for you. Where you have this procedure, the comments, the name, the email address, the phone number. At the time that it's submitted, that is instantaneously information is transmitted into myPracticeBuilder, and you're able to associate the source with the prospective patient's name and move that forward through the process of nurturing them into becoming a patient. And the way we do that is we work to convert. This is the most crucial part of the activities that you have. I mean, it is absolutely what will make or break your business, is that we give you the tools that alert you by email and text when an inquiry comes in. We're able to send targeted email campaigns, and I'll show you an example of that in a minute, that are targeted to either the service or the procedure specific to each different inquiry. We send appointment reminders by email and text out to your new patients, and every call is recorded. Through these series of steps, through these series of tools, we're able to increase that conversion from inquiry into patient. An example of that is, let's say Bonnie here that came in off the website, filled out the information, and at the times that happens, there's just what's built into myPractice that will go off at the time that you designate. So, for instance, let's say that between Monday and Friday, 9 to 5, you say that all inquiries that come in off your website must be contacted in 20 minutes. Well, what happens when minute 21 rolls around? Well, then there's a text reminder and an email that's sent out to either you or one of the designated members of your staff that alerts you that Bonnie is still out there waiting for you, and that she needs to be contacted, so that you're absolutely putting your patient's needs first. That is what That's what they're expecting. That's what you have to do, and we give you the tools to allow you to do that. Next, we nurture those inquiries and appointments with personalized emails that are sent out based on their needs in a sequence that we help develop with you to help just add another layer of communication in a way that people respond to. Email is one of the most effective forms of communication, and this is a tool that allows you to build that inside of an intelligent design. And part of that design is the sequence of emails that are going out as well as follow-up phone calls. Now, we've been teaching for many years that it takes several phone calls, at least 4 phone calls, to bring in each prospective patient and nurture them into doing business with you. Unfortunately, most practices only make 1 phone call. And so through an orchestrated series of follow-up phone calls that are prompted for your staff within myPracticeBuilder and emails that are going out to those inquiries, you're able to help convert those and track and record each one of those incoming phone calls. It even tells you when you should call. So, for instance, if you've tried to call on Monday and Tuesday in the morning and you haven't gotten a hold of them, it'll recommend that you call them in the afternoon on Wednesday, perhaps. It learns from what's happening based on your own experience. Next, we will work with you to come up with the series of emails that make sense for all the different services and procedures that you offer. But here's an example of one. So within the first 24 hours, an email goes out that introduces the practice, it gives testimonials, invites the patient to look at your social media tools that you're using. And then, of course, your phone calls will go out in the time between that and the next email, which may be 3 days later. We show before and after photos, if that's applicable, and then offer appointment times to come in. Then perhaps a week later or 3 weeks later, other emails will go out if they haven't converted yet. And of course, at the point that they've scheduled, the emails will stop. We can even use this if we have a no-show to try to re-engage the patient, to remind them about why they set the appointment in the first place, to get them to come back in. There's a number of ways that we can use email very, very effectively to help convert any kind of inquiry, any interest in your practice into a new patient. The time to set the appointment, there's a couple of things that we do that are very unique. We send out an Outlook, Google, and Yahoo calendar reminder. Those are the 3 most common calendar reminders that many people use. And that will be sent to them directly, so they can put that in their own computer, just like you probably have used with the notification for this webinar, and get them to come in. The day before the appointment, an email is sent out with a map from their house to your office so nobody gets lost. And then if you're collecting their cell phone number, on the morning of the appointment, a text reminder is sent out as well. All is built into myPracticeBuilder. If that goes into, so we've done all these things to convert someone. Now, we've got to look at what works and be able to make decisions based on that. So I know a lot of you, probably from what you've learned in the workshops with PracticeBuilder, you're probably counting how many phone calls you're getting from each different source, and if you're not, you should be. But what's even more important than that, and is much more difficult to determine, is what is the conversion rate? So maybe that billboard is generating a lot of phone calls, and you think that's great, but what if the context of that is not putting the right message out? Well, within myPracticeBuilder, you're able to know the conversion rate. So, and even more importantly, you're able to know the profitability. So you're able to evaluate one source, one referral source, and one marketing source versus another, and know what works and what doesn't. And even just as importantly, you're now able to evaluate your staff's performance. You're able to listen to each phone call. You're able to see how many times they follow up with each patient. You're able to see what percentage of the time that they have an inquiry on the phone, are they able to convert them? And so you're able to dedicate and hone in those resources that work best for your practice, and ultimately give better care and better prepare the patient and set their expectations for the service that you're going to provide. And people look at what's happening in a dashboard view. We make it very simple for you to look at in just what we call the doctor's dashboard. You're able to look at the staff performance, the return on investment. You're able to look at, within moments, you're able to see what marketing expenditures aren't working and make decisions about what you should eliminate and what you should improve. Look at your staff performance and then allow you to make those incremental changes using database decisions to improve workflow efficiency. All of these things together make the absolute difference in the profitability and the scalability of your practice. You're able to know with confidence what to do. So you'll know exactly what sources, everything from referrals to pay-per-click to a billboard to radio to a brochure, you name it. You'll be able to see with absolute specificity what percentage of those calls and inquiries, where they're coming from. So for instance, if pay-per-click or referrals, if those two are 80% of your revenue, they're only generating 14 or 12%, you can make decisions about what you should scale and what you should pull back. They even go a level deeper. Okay, you're able to look, and this is an example. Let's say a magazine ad in the course of a couple of months pulled in 110 inquiries. Well, now you can look at what percentage of them were not qualified. You can look at how relevant that referral or that marketing source is and your ability to convert them. You can see what percentage is still pending, and then look at what percentage convert into scheduled appointments or consultations. And then evaluate the expense, in this case for the magazine ad, it's $2,000, and look at the revenue, $172,000. So now we have the return on investment on a down to the penny. You can convert. You can look at one source versus another, and make decisions about what you should change and what you should improve. Just those activities to maximize results, eliminate or improve what doesn't work. And now it's something I'd like you to consider. If there's a service that you've been considering and you're just not sure about it, you don't want to put everything behind it, but you'd like to test it to see, put your toe in the water to see what would happen. You're now poised to be able to take advantage of that and do it on a small scale. So if there's a specialty that you just want to try something out in one media source and look at, can we market this in a way that makes sense for us? Can we start small, evaluate it, and then scale? You can do that with myPracticeBuilder, where you couldn't before, where you didn't have the confidence to know what was going to happen. Improve your staff infrastructure. You're going to have absolute transparency into what's happening with your patients, how they're being greeted, how they're being handled, how many times they're being followed up with. And of course, we at Practice Builders will stand with you to figure out what the next steps for your practice are in a way that we've never been able to do before. Where you call us up and say, John, my conversion rate's just not where it needs to be. And we're able to then log in with you and look at what's happening, give a bird's eye view of what's happening with your practice. And then if we need additional staff training, if there's social media aspects that we need to add, if there's any other marketing activities, or whenever we need to work on improving your referral base, we'll be able to do that with you in a way that we haven't been able to do before. And that, in essence, allows you to adjust those activities either on a monthly, an annual, or even on a per inquiry basis, and adjust those that maximize return on investment. Let's keep doing more of what works best and do less of what doesn't. It's really simple, but now you have very objective data to determine what needs to happen. That, in essence, is the entirety of what we're doing with myPracticeBuilder. From starting from tracking to converting to improve that ratio of inquiry to patient, looking at the results of that for both staff's performance as well as your referral and marketing activities, and then adjusting those that perfect your practice. And in essence, do what one doctor said. John, I now know how to scale my practice. I now know if I do these things, then I get this result. If I want to grow 20%, I know how to do it because I've got the data that shows what's been happening. And this is something that doctors have been asking for years. Our marketing consultants have been wanting for a long time, and now we're able to present this to you, and we're excited to do so. So this is an example of what's happened with one of our practices. This is an ROI calculator that we worked on with them, and we looked at the number of new inquiries they were getting on a monthly basis, and they were getting approximately 50. And then we were able to measure what percentage of those were becoming new patients, and so 50%, which was extraordinary. I mean, your practice may not get a 50%, which what they were doing right off the bat was amazing. They were taking those 50 inquiries and turning those into 25 patients, and I know it varies on a per practice basis, but with their practice, they were getting in the first year an annual billing of $1,500. So those 25 patients were turning into $37,500, but through making incremental changes, knowing what's happening, and be able to take action on it, we were able to increase that 50%, just another 20% more to 60%, which made a net difference of $90,000 that was before was falling through the cracks. This is not even spending another dime on marketing, let alone what we're doing if we have more profitable marketing sources. Now we have the confidence and the justification to expand those, but we don't stop at 60. 60 is not the upper limit for what we're trying to achieve here. What happens to that $90,000 if we get that to 70 to 75%? Who knows where we can go? And we're well into six figures just by making small incremental changes all the way from the sources that we use all the way to the way that we follow up with folks. So let me show you a couple of examples that when you're inside of Practice Builder, what do you see? Well, there's two things I want to show you. First, I want to show you the reporting that's in here. You'll be able to see at a glance, you'll be able to see your business, your practice scaling, how many scheduled patients you have. You're able to see the inquiry sources, or what we call the lead sources here. We're able to see the market share. So everything that's coming in for the period that we're measuring for, 38% were coming from a postcard. The dental site, which is a directory site, was bringing 19%. Google is 23%, and so forth and so on. Then for the rep. So for each rep that we have, how many calls do they take? What percentage were scheduled? What's the time gap that's between when an inquiry is made versus when they were responded to, and then how many total scheduled patients? One of the other aspects is that after a patient has scheduled, they've had their procedure, they've had their consultation, or received their service, we're able to send a feedback or an email to get their satisfaction. And then as those come in, as they grade you, and now you've got that feedback loop that you've been wanting, you're able to drill deep and see what's happening, and you're able to, if there's something negative, you're able to address that, and you're able to take those testimonials and their feedback, and you're able to publish those, and we'll help you with that as well. And then finally, you're able to look at those sources, and you're able to look at how many inquiries came in. Let's say this is just for a month. What percentage weren't qualified? What percentage are still pending? And then what's been scheduled? And then what's the expense and the revenue? And we're able to look at, for instance, in this case, the yellow pages, we're losing money, but we're making all kinds of money off of the directory site, 101dentist.com. It also can apply to, if you're in a different industry, it will apply to you as well. From a patient's perspective, here we've got Sally, and we used one of our tracking phone numbers that we have listed for Google Places. It came in automatically. It pulled in her name, it pulled in her city and her name. It associated with Google Places. We're able to select that there's a dental implant and have emails that go out for her, and we're able to schedule a consultation and set reminders. So this is a very powerful tool to everything that we need to communicate with any new inquiry. We're able to do so from just this one screen. As far as the way that we've set up myPracticeBuilder, we have 3 levels of service. First, that will apply to many of you. You can have as many staff members as you possibly have for one physician in one office location. We'll give you complete integration with everything that all the sources that you're already using. Response time tracking so that you're more responsive and more engaging to prospective patients. Set up all your email campaigns that you need for all your different services. All the reporting that you need, and call tracking and click to call, as well as scheduling your consultations and even setting things up when you have those now elusive, or those very few no-shows. We do that for $349 per month. We have a larger practice with more physicians and more locations, and we can even go far beyond the 6 and the multiple locations here, but from $349 up to $849 per month. So, in essence, that's how myPracticeBuilder is priced. We have an irresistible bonus that we'd like you to take advantage of between now and March 9th. If you're interested in receiving more information, doing it one-on-one, or if you're ready to move forward, and take advantage of the free tablet computer that we'll provide you, as well as a free mystery shopper call. This is a very powerful tool that a lot of our practices use that is included with myPracticeBuilder, where we will call your staff once a month based on whatever scenario that you want us to look into, whether you want us to have a phone call if someone is out of network, or if there's a specific service or procedure you want them to inquire about and see how they handle any kind of objections. Those will be included every month that you're with myPracticeBuilder. You have till the 9th, and feel free to email us at either put your name in the chat box or email us at mypb@practicebuilders.com. Anyway, that's the presentation. And now, Larry, do we have any questions out there that we need to address?
We do. We have quite a bit that came through the chat box. And again, thanks, John, for your valuable information about myPracticeBuilder. And so during the webinar, there were a few number of questions that came through the chat in which we will respond to them in the order that they were received. And if we don't have time to get to your question, we do apologize. And so therefore, we will contact you directly with your contact information that you've provided through the registration process to make sure that your question is answered. And so the first question I have is a great question. John, how much training is involved for my staff if they decide to pursue myPracticeBuilder?
Okay, excellent question. We get people up and running in a very short period of time. We will work one-on-one with each one of your staff members. Well, first we'll work with you to determine what each staff member is their area of responsibility. And then we will work with them to show them it's very simple what they go through day in and day out as far as receiving the inquiries in, being able to set up the reminders to call them back, to being able to evaluate the sources coming in, to be able to select the right, to put in the right procedures that are applicable to your practice and have those emails that go out. So it takes one-on-one intensive training for about 30 minutes with each one of your staff members, and they're about 90% of the way there. And of course, you get unlimited. We offer unlimited training, and so you're able to call any time of the day and get immediate feedback. And then we'll be providing videos as well for you. So usually you can have your entire staff up and running inside of 3 or 4 days at the utmost.
Wonderful. Thanks, John. And John, just to remind you, did you want to go back to that or advance to the next slide, just to show that screen for people to maybe note down the expiration date and or the contact information in which to email you about more information?
March 9th.
All right.
mypb@practicebuilders.com.
Okay, wonderful. Thank you. Next question. Somebody wanted to receive more information about how exactly the call tracking system works. Can you elaborate on that a little bit? Thank you.
Absolutely. Well, built into, once we enable that feature within myPracticeBuilder, what we do is we select the state, select the city, and then automatically it will publish, and then what you have to do is put in the inquiry source that you want that phone number for, and then what will happen is it will auto-generate a phone number within that is specific to that city. It's more than just an area code, it's specific to that city, so a prefix that's within within that city, and then we just type in the number that you want it redirected to. So, for instance, if you want that to go to your main line, that will go to your main line. If you have, for instance, if you have a Yellow Pages where you already have a tracking number, you can redirect that number. Instead of going to your main line, will go to this new number that will then be redirected to your main line. It all happens automatically, but it's very simple. I mean, that's probably the easiest thing to do within myPracticeBuilder. And one of the things that's very powerful to use is to also use that for referral sources as well. So if you're, for instance, an orthodontist and you have 5 different dentists that refer business to you, we can give a different referral number to each one of those dentists. So as those come in, you can, those will be tracked automatically inside of myPracticeBuilder, and then we can even have email campaigns. This is really cool. We can have email campaigns that go out to those prospective patients that leverage the existing relationship that exists between the referring doctor or physician and the patient. So that's just another great tool. It's very, very simple to set up.
All right, great, thanks. And John, you just answered actually another question within a question about practices wanting to know if the system can track referrals.
Yes, absolutely. Let me just go through that again. So if you're a specialist of some sort and you get referrals from other practitioners of some sort, we can allocate phone numbers specific to that referring practice that they distribute to their patients, so that when they call in, you'll be able to know specifically where they came from. A lot of times, it's kind of murky when you get referrals sometimes, because you'll have let's say you're an orthodontist and a dentist refers a patient to you, but a patient saw something about you somewhere else. And when they say where they heard about you from, they say, I saw you online or I was on your website, and that referring doctor is not getting the credit that they're due, and you're not building, you're not strengthening the relationship you should be strengthening. Well, that phone number just kind of, it kind of takes care of everything for you. So as long as they have that phone number and they call in, that comes in a direct line, that's tracked and tagged within myPracticeBuilder. Very powerful tool to use for referrals.
All right, wonderful. Thanks, Sean. Next question here. Can this replace my appointment setting software or applications I'm using now at my practice?
Absolutely. This will either work in conjunction with, or it can absolutely, it can replace. I've talked to a lot of physicians that are using a standalone service for, it'll send out the email reminders and whatnot, and that might cost a couple $100 a month. This will absolutely, you can stop that service and include that as a part, use that as a part of myPracticeBuilder, or we can work in conjunction with those. It depends on what services you choose to use, but it absolutely makes sense if you've got something that does. And I've found very few appointment setting services that actually send out reminders for Outlook and Google and Yahoo. That's a very powerful tool that takes a lot of it really drives down no-shows. But absolutely, we can replace that or work in conjunction with it. Either way, it's that flexible.
Okay, great. Next question I have here: how long does it take to start seeing results from myPracticeBuilder? I'm sure a lot of people have that question.
Sure. Well, of course. Well, I'd like to say that everything is transformed on day one, but that's not exactly realistic. But normally, because it takes time to once everybody's trained and all the numbers are distributed and all the sources are and integrated and everybody's trained. Usually, in about the first 45 days is when you start seeing some significant traction, and then, of course, it's really using this new tool and making those small changes. So, in order to have a change, you've got to make a change. It's rare that everything's going to transform overnight without doing some things that are different. So, you got to get used to listening to the phone calls. You've got to get used to redirecting changing those marketing sources. So there is some time lag. I mean, it's one thing to have the information, it's another thing to execute upon it. So it really, a lot of it revolves around how responsive you are to the information that you're getting. So trusting and having confidence, and that takes time. So normally after about 45 and 90 days, that's when you're really starting to see that you're starting to have a baseline of what your conversion rate is from inquiry into patient, and then you're able to make those changes. And we've seen a lot of practices. They say we are now doubling the results we're getting from all our marketing activities, or we weren't even doing any marketing before because we weren't, we tried something and it didn't work. We didn't know what was working. So now you're able to scale and make those changes, but having that confidence that you can do something that's predictable and repeatable and reliable, and that is the bread and butter of what myPracticeBuilder gives you that ability to do. And so it's having confidence in making decisions, learning how to read the data, and being able to make those small changes with your staff and with your referral and your marketing activities. But within 90 days, and then from that point on, it's all about just ratcheting up and increasing that conversion rate, adding more services, and making your practice go where you want it to go. But absolutely, I mean, in a very short period of time, you're going to see tremendous results.
Okay, great. And John, you just mentioned about how it takes some time to really see the results and to make judgments on improvements and things like that. With practice builders, what type of support? This is another question, by the way. What type of support does practice builders, can we offer after using myPracticeBuilder, and with any type of marketing assistance or things like staff training that could really help maximize their success?
Well, absolutely. We stand ready at any time at all for as long as as long as you're in business and as long as you continue to use us as a resource and use myPracticeBuilder. keep in mind before when you had a need for something, you were able to call us and say, well, I've got a problem with this. We've got to interpret what you're saying. We've got to understand it from within our own point of view, and then be able to craft a solution. Well, now we can, with your permission, we'll then log in with you into your login to myPracticeBuilder and look at the same data with you. So now we are better poised to be a resource for you than we ever were before, and we will always stand ready to assist you with, because we now understand the context. Instead of just understanding, you've written down what the problems are and you've told us about them, now we can look at them from your point of view and see what's happening. Sometimes it's multifaceted what's going on. We may think that, before we may think, well, we've just got one staff member that we've got a problem, maybe we need to fire them or make a change or whatnot. Now we can look at, or maybe there was a marketing source that you thought, well, we tried this and it really wasn't working, but what we didn't know was that the marketing source was generating the inquiries, they just weren't being converted, they weren't being followed up on properly. So we stand ready, for as long as you need us. We've been around for 31 years, and we're going to be around for decades and decades more to stand with you and use this solution that we together can work as partners to determine what makes the most sense for your practice that's going to make that impact in improving the care that you're giving and making sure that your message is being articulated in a way that is responsive, that is receptive to to those prospective patients in your city.
All right, great. Thanks, Sean. I think that's all the time that
Sure.
we have for the Q&A session.
Right.
So thank you again for your time tonight. The information was incredibly
Absolutely.
valuable. And I'd like to thank everyone for taking the time to join us tonight for our webinar, learning about myPracticeBuilder and how it can improve your marketing ROI in addition to your new patient follow-up processes. Feel free to visit us at practicebuilders.com or like us on Facebook, check out our blog, follow us on Twitter, connect with us on LinkedIn, or review us on Yelp. Again, as a reminder, we will be sending out copies of the webinar slides and recorded versions once the webinar has concluded. For any additional questions, feel free to contact John directly at jmccumber@practicebuilders.com or give him a ring at 1-800-679-1200. Thanks so much again and have a great night.